Nervecentre plays a really important role when it comes to interoperability. Interesting, we adopted Nervecentre way before we introduced our own electronic patient record, and what it proved to me was it helped people adopt technology, did Nervecentre, and played a vital part in getting people on board. So that interoperability piece with our EPI was critical. Because our staff were almost wedded to Nervecentre, so finding a way through was really important, really important.
When our clinical colleagues had the opportunity to look at what Nervecentre had, the judgment that they came to is that the best world would be is if these things could work together and could talk together. It was really clear that people really started to understand the patient outcome benefits of Nervecentre. So at that point, once our doctors, nurses and therapists were telling us that, it really became quite a straightforward conversation to have, and it was about finding an interoperable solution, and we achieved that.
We chose to keep Nervecentre because it was so important to our end users. Our end users, so people, nurses and doctors on the wards, actually really adopted Nervecentre and took it on wholeheartedly. It was really important for us as part of our engagement to make sure that we had heard what they wanted.
It really became apparent that we needed the technology to talk to each other so that we could really enhance our digital technology and actually further improve our patient safety within the organisation. So a big part of my role has been working with Nervecentre colleagues to look at how we can actually get the technology to talk to each other so that we can continue using the electronic observations and continue with our hospital at night programme.
Nervecentre really brought that ease of use interface for our staff, and certainly when we came to thinking about how we were going to work within the EPR, our staff very much wanted to keep Nervecentre within the hospital because they could see the benefits both for the patients and for their own working as well.
Prior to EPR going live, the staff on the ward actually thought they were going to lose Nervecentre, and they were devastated. It was you were almost like you were telling them you were going to cut the right hand off.
The impact that Nervecentre had across the hospital was quite incredible, and we wanted to keep that, so that sort of integration was important. What I found really useful is that both Cerner and Nervecentre colleagues were prepared to talk. So not only have we got the best of both worlds by having the mobility and the escalation, we've got something that we can showcase to other people, and we feel quite proud of that.
Having worked with Nervecentre and having that kind of innovation, actually what it showed to me was that there's a marketplace to be able to use innovative solutions and a more static electronic patient record.
It's very clear to me that if you want to help your organisation move to a position where they're not fearful of technology, I think Nervecentre gives you a real opportunity in that respect.